board meeting for July 28, 2023. Gail, I'll now ask for the roll call, please.
Luc Charbonneau,
I'm here once I can find the mute button. And Chris Peabody is texting me saying he's trying to get in, FYI.
okay, I'll resend him the link, thank you. Helen Claire Tingley,
Good morning. Can you hear me?
we can.
Excellent, thank you.
Sue Carlton,
Present.
Gordon Mill,
Present.
Alan Barfoot,
Present.
Nick Saunders,
Present.
Kevin Eccles,
Count Court.
Sue Patterson,
Present.
Kenneth Craig. Kenneth Craig. Gordon Peabody,
Yeah, present. Can you hear me?
yes, thank you.
Okay, thanks, Gail. Any amendments to the agenda? Okay, we've got two. Dr. Era, you can go first.
Yes, please, if we can add a quick update on COVID, a short update under the MOH update.
That would be 7.3 then. And the amendment that I'd like to see us make is under correspondence, 6.1.7, the Ombudsman report. We discussed this at the last meeting. I think it should be having a separate motion to it. It was determined as long as we receive it, but I think it, for our books perspective, I think it would be better if it had a motion to receive that instead of just receiving it with all the other correspondence. Okay, anything else from anyone then on amendments? Helen Claire?
Mr. Chair, thank you. Just to flag, I'm struggling to hear. My speakers are at high. I'm wondering if you could turn up yours. Thank you.
Can you hear us now, Helen Claire? Okay. Did you catch the amendments that I had suggested then? Okay. Okay, so we look for a mover then for approval of the agenda. Gordon Milne, second by Sue Patterson. Any further discussion then on the approval of the agenda? It's all in favor. That's carried. Any disclosure of pecuniary, sorry, Luke, had a question or just voting?
Just voted.
Just voting. Okay. Down, any disclosure of pecuniary interest? Seeing none from anyone, the adoption of the minutes of Friday, July 23rd. Have a mover for those minutes, please.
Sorry, it's
Gail?
June 23rd, not July.
I'm sorry. June 23rd, moved by Kevin Eccles, seconded by Luc Charbonneau. Any discussion on those June 23rd minutes? Call the vote, then all in favor, that's carried. And then minutes from Friday, July 7th. Can I have a mover for those, please? By Sue Carlton, seconder by Helen Claire Tingling. Any discussion on those minutes? Seeing none, call the vote, then all in favor. That's carried. Correspondence and news releases. First one then is 6.1.1. Dr. Aaron.
Mr. Chair, we have 6 items under correspondence. The first one is a letter from the Board of Health and Public Health, Sudbury and District. And it's the subject that they brought forward last year about personal protective or personal safety devices on boats that they had a letter to the province requesting from the government enacting legislation requiring all individuals to wear personal floating devices on boats. We received, we had discussion around the table in 2022, and we decided to receive, and my recommendation is to receive also. The second item is letter from the Board of Health for Huron-Perth Public Health. And the third one as well, both letters, one is to the provincial government, one of the federal level, and they're related to requests of the development of comprehensive cost sharing universal accessible national school food policy, or the second one is on the province level. And the recommendation is to receive. We had multiple initiatives related to the subject as well in the back in the history of the health unit. The number 4 is letter from the Board of Health for Public Health Sudbury to the Premier of Ontario, and the letter is the response to the introduction of Bill 103, which aims to prevent youth from initiating vaping and decreasing the current usage of vaping products. And the recommendation is to receive, and the reason is we had supported multiple documents similar to this over the past 2 years. Letter from the Board of Health, number 5 letter from the Board of Health for Porcupine, and it is directed to the Minister of Environment, Conservation and Parks. And the request there is to install air quality monitoring station in their area. The recommendation is to receive, and it's worth mentioning that we had discussed recently with the smoke incidents from fire, whether we should advocate for a monitoring device in our area or not. We depend on the one between us and Huron-Perth. And historically, in 2017, there was a study that showed that the weather event or the reading in that location is very consistent with the reading in Grey Bruce. And at that time, there was no recommendation. Recently, in these events, there were some discrepancies, and especially that the smoke is coming from the north. So whatever happens here might not happen at the monitor for a few hours, or might not, depending on the wind. So again, that might be an item for the board to consider, whether we want to advocate for our monitoring device in Grey Bruce. But for the correspondence we received, my recommendation is to receive. And the letter from association from Public Health Ontario Public Health Business Administration to the Chief on Wage and to the Minister of Health and the Premier. And the recommendation there is to receive its general recommendation how to modernize public health as a sector. I'll stop there, Mr. Chair. You said you want to separate that too.
Perfect, thank you. Any questions then on those 2 or 6 pieces of correspondence that were Dr. has alluded to there? So can I have a mover then to accept those 6 pieces of correspondence? Helen Claire, moving. Do you have a comment on to Helen Claire, or just moving it? Moving, okay, and a seconder? Nick? Any further discussion then on those 6 documents? All in favor? That's carried. Then the last, the motion then to receive the ombudsman's report. Dr., do you want to speak to it at all?
Certainly, Mr. Chair. Like last time we brought it forward, and there was a need for more information. So that was provided by email, separate from the agenda. In essence, the board received in February the initial report. We had discussion about it. We responded to the ombudsman, and our response at the time was circulated, and was well received by the ombudsman office, was included actually and praised in the final report. And the recommendation or the direction from the ombudsman's office is to pass a resolution with the final report receiving it. And when we received it in March, the board had a discussion, and we did not pass the resolution. So for that, it's discussed practice just to separate it and pass a resolution for it.
We decided at the last meeting that we would bring it forward to this meeting to have it so we get it's a separate issue. Helen Claire?
Yes, I'm happy to pass a resolution to that effect. Thank you, Mr. Chair.
Okay, so the motion moved by Helen Claire, second by Warden Milne. Any further discussion then on that motion? All those in all in favor? That's carried. Thanks everyone for that. Now we're down to media releases and I see Denise. Denise, welcome.
Thank you. And through you, Mr. Chair, 6 media releases are included on today's agenda. The first issue, July 10th, reminded parents and others of Smoke Free Ontario Act rules banning smoking or vaping on or near sports fields, skate parks, spectator areas, and playgrounds. On June 29th, the media release was issued to urge people to always observe wildlife from a distance and resist the urge to feed, pet, or keep as pets any wild animals. The potential transmission of rabies or other communicable diseases from wildlife to people remains public health's primary concern with wildlife-human interactions. On June 23rd, Public Health issued a media release following an opioid overdose alert, which went out to the public after Public Health received reports of 4 suspected opioid overdoses, including 1 fatal overdose over a 6-day period. On June 21st, Public Health issued a media release regarding vaccination clinics that will be held this summer for students entering senior kindergarten to grade 5 who require 1 or more publicly funded routine vaccines. And finally, on June 27th and June 30th, Public Health issued media releases to advise residents of potential air quality concerns due to smoke pushing into our area from wildfires in Eastern Ontario and Quebec. And these releases contain public health recommendations. And that concludes the review of media releases on today's agenda.
Okay, thanks, Denise. Could I have a mover to put them on the floor, please? I don't see Warden Peabody, but I'm assuming he's still there. Just wondered, Chris, are you prepared to make sure you're involved in the meeting? Are you prepared to move that, Chris?
Yes, I'll move that. I'm certainly
Sure.
here, Chair, listening. Couldn't get on, so just switched to the phone.
Sure, okay. I have a seconder then to receive the media releases by Kevin Eccles. Any further discussion on those? Luke Charbonneau?
Yeah, thank you, Mr. Chair. I just, with regard to the press release on the student vaccination clinics, I was wondering, so I actually, as it turns out, my young son was behind on his vaccines because of the pandemic. And so we received a letter from Public Health telling us that we needed to get that updated. And of course we will, and have actually. But the thing that kind of struck me about that in relation to this was what we received was sort of a very stern letter saying, you know, get this done or you may not be admitted to school, but without, you know, this information connected to it. Like there's ways that people can get access to these vaccines that Public Health is making available. And I just wonder if it's possible in future when you're sending out those letters to families saying get your kids caught up on their routine vaccinations, if you could also tell them, and here are some opportunities Public Health is creating for you to get that done, because it's complicated. It isn't easy to get into primary care to get vaccines. The long wait times. It's a pretty tight turnaround. We received that letter from Public Health, and within like 2 or 3 weeks, it said you must report back to us within, I think it was 2 weeks or 3 weeks, saying this is done, right? And it's pretty hard to get in to see your primary care provider in that length of time if you have a primary care provider, and it creates a lot of stress for families. And here we have this saying to folks, Public Health is creating these clinics. I just wonder, when we send those letters to parents, can we also say, here are some upcoming clinics that we're providing, and here's some opportunity for you to get these vaccines done? I think it would take a lot of stress off parents who frankly don't need additional stresses in their lives. What are your thoughts on that?
Dr. Eric, to comment to that?
Thank you for bringing this forward. We always in our communication include where resources are available, and obviously we dropped the ball on that letter. I wonder if Dr. Zaid want to add anything to what I'm saying, that this will definitely be corrected, whether it is a small group of letters or the entire letters or the entire communication. Denis knows this better than anybody else. I always divide our communication, and this is what's the incidents, this is what public health doing, this is what the individual needs to do with the bulk of information and the links.
Through you, Mr. Chair, we have with the vaccine preventable disease program, they have developed a very good communication package. Part of it was a good social media campaign about public health rules and about the clinics, and we put the calendar of the clinic. We shared it with the Board of Education, and it has been shared before. This is a kind of a reminder for parents, assuming that we had that was done widely through the social media and through other letters. In addition to that, we are going to have a text to all parents and include the link for the calendar of public health, because we know that this is really very stressing or stressful to parents to try to prioritize it, but it is really part of a big plan. And all the website, our website on for public health is updated on that, so that the people can reach the public health to get their kids vaccinated.
That answer your question, Luke?
I'm just saying that's all good stuff, and I appreciate all of that. I just say in future, maybe just stick the calendar in the letter that you send, you know, so that and then folks who are getting that letter have it right there. They're the ones who need it most. They may miss the social media campaign. Certainly, here I am. I sit on the Board of Health, and my wife was dealing with this issue, and she wasn't aware of the vaccine clinics. So that's probably me dropping the ball and not being fully aware of what vaccine clinics the health unit is doing. But I just think, you know, if my family couldn't easily connect to that information, it's probably difficult for others too. So anything you can do to put that right in the hands of the folks who need it would be good in the future. And that's, I'm sure you're doing that, and I appreciate your efforts on it. Thank you.
Thank you. See you, Mr. Chair. My information is that we have this added to the letters, but I will connect with the TPD program, because sometimes the school board, like, I need to know to clarify that and get back to you, because sometimes they say you need to only have this, or maybe the school board had like change it and not the content of the letter and didn't include it, but I will get back to you on.
Thank you.
Okay, thanks. Dr. Aaron?
One more point through you, Mr. Chair. The comment about the Stern letter, that language comes from the Act. It's a law, so you know, sometimes we always prefer the least intrusive, but that's a letter of the law has to be included in that letter. So again, it's not directed to the parents or that the parents drop the ball, or so it just has to be worded that way.
Board Milne.
Thank you, Mr. Chair. How do we determine where the clinics are going to be held?
Through you, Mr. Chair, we strategically have accessibility, like many clinics in turn every week. And in addition to that, there is one weekly clinic in the house unit. So there are like the same way that we were having this community center clinic in the across the Grey Goose. We are spreading the clinic in the community centers.
Is that available on the website then?
Yes.
Board Milne.
But I'm reading here, the clinics are held in Owen Sound.
What?
Are they being held in any other communities or just the?
Yeah, they are helping our communities in addition to a fixed clinic in Owen Sound in the house unit.
So is that included in the press release or not? That they're being held in other communities?
The calendar is, the calendar on our website include all the website, where the clinics are held.
Okay, thank you.
See your
we
point.
we can add a link to that calendar. Usually we do that.
Okay, good, thank you.
Okay. Dr. Barry, you were on the comment?
I was gonna answer technically, I thought the question to you, Mr. Chair, how is it decided? So we look at different ways. One of them is where the lower rates of vaccine and we tailor clinics to that school and communication to that school.
Yeah, okay, I get it. Okay, very good. Yes. The word would read the actual release.
Any further discussion then regarding the media release? Had a good discussion on a number of issues today. And mover and second, we'll call the vote, then all in favor to receive the media releases. That's carried. Thank you. We move now on to the medical officer's health report. First one is 7.1, the opioid situation in Greybury standing update. So Dr. Zaid, I'm assuming this is your document.
So through you, Mr. Chair, I have three local updates. One about the LTCP project on prevention of opioid and unregulated drug use among youth from 14 to 25. So we have completed that project, and we are in the process now of this finalizing it for publication, including an infographic and communication to stakeholders. So that is the next couple of months. The second thing we have, Dr. Aaron and myself, we have the pleasure and honor to visit Niwash First Nation community on a discussion about the situation there, and it was really a great discussion with the chief and Mr. Nick Saunders and other community members. So we are really grateful for this opportunity. The third item is related to the drug and alcohol strategy, the local drug and alcohol strategy for Grey Goose. So through the steering committee, we are working now on changing the strategy or updating the strategy, and it will be big work in the next couple of months through a facilitator and the engagement of all the stakeholders, community and health stakeholders in this. In addition to that, the coordinator of the position of coordinator of the alcohol and drug strategy is now vacant, so public health will fill this gap in time by adding having the coordinator role and also support through our population health data, myself and other foundational standards. So we are trying to make this community alcohol and drug strategy robust and more updated and more engaging. Not that the public health will be like having is one of the core members, but we are not adding any we are respecting the community engagement in the same time and the community stakeholders. But it just from our due diligence and role to have this strategy strong and more with more engagement of everyone. Thank you.
Thank you. Comments?
Comments. I was grateful that Dr. Aaron and Dr. Zaid came up. Unfortunately, CTV News did not make it up until 1 o'clock, just due to the timing. But it was very well attended, our fire. We will be doing a 4-day sacred fire coming on August, starting on morning of August the 8th and going until August the 11th. That fire will be lit to be able to get the answers that we need to start to address this opioid issue crisis that we are all facing. It's not just First Nations, but more prevalent in our First Nations as we're all related in there. We opened that door up to be able to have the Ontario Provincial Police come up and attend so that they are also a part of that equation. And I'm sure that any of you folks that want to come up as well will be welcome to come up at any time, because once that fire is lit, there will be somebody at that fire right from the time it's split until it goes out on the 11th. And we'll be doing type ceremonies, stuff like that as well for some of those answers, and remembering the ones that have won their battle or lost their battle, if some people want to say that. Those ancestors that have passed on, they have the answers. They're still winning that. They're going to help us to provide us with those answers when we light those fires and stuff. And I see this, that it's going to probably spread across most First Nations. We're going to let some other First Nations folks know, so that when we light our fire, they'll probably light their fire, and they'll have their elders smoking their pipes to pray and to get those answers that we need. So.
Thanks very much for that update on that, Nick. Sue, Carl.
Just a question of Nick, where exactly will that fire be taking place?
That fire will be taking place at the Medobe Senior Center. We have a fire pit, a fire arbor there. So like I said, that fire will start at approximately 5:30 to 6 o'clock in the morning.
Okay.
And it will burn continuously around the clock until Friday, the 11th, August the 11th at noon hour. That's when that fire will go out.
Thank you.
And like I said, you folks are welcome to come up to that at any time. I think it's important that we show, and if there's somebody that's struggling, if they're going to come up, that's fine too, because that may be what they need in order to get through what they're going through. So we're going to have counselors on hand as well. Our mental health team will be there and present, so that they're there to help those folks that are going through their struggles of remembering their kids or whatever. And it's going to be a very non-structured, structured, sacred fire, if that makes sense.
Good. Okay. Thanks very much for the clarification. Okay, we'll move on to the other two items under Metacogster's health report, and then have a motion to receive all of that then. So Dr. Airy, your report is the 7.2?
Correct, Mr. Chair. This staff report prepared by the infectious disease team, and it's related to the sexual health clinic in Grey Bruce. So in general, just background for the benefit of people who are new around the table, public health used to have sexual health clinics and work done in the community and the schools. And over the years, that was ensured to be done through primary care and other healthcare system partners. And we kept the core function locally in the health unit clinic. After the pandemic, we've seen, before the pandemic, in the past 4 or 5 years before the pandemic, and during the pandemic, we've seen increase in the sexual health cases, numbers, and rates in Grey Bruce and across the province as well. And after the pandemic, we responded to the gap in the healthcare system, where it seems there are many patients don't have family health, family doctors or access to care in a timely way. So we created clinics, and we have been delivering these clinics across Grey Bruce in all 17, not in all 17 municipalities. Patients from all 17 municipalities have been attending our clinics. So we're positioning them in different locations in Grey Bruce in a way that allows access. And it has been actually a success, where we got a number of interviews from CBC with the program manager, delivered on a very nice interviews outlining our work and support to the healthcare system in general. But if you look at the Health Promotion Protection Act, it is, it assigns to the Board of Health the mandate to ensure these services are delivered. Not necessary to deliver it ourselves, ensure somebody else delivers it. And when there is a gap there, the health unit stepped in and we have been delivering. And obviously, there are more details in the report, but in general, it's growing and it's supporting the community. And hopefully the healthcare system is gonna do its turn on delivering these services, and we go back to the baseline that we were in a few years ago. I'll stop there, Mr. Chair. Open to questions if you.
Sure. Any questions for Dr. Ayre regarding the sexual health report? Seeing none. Move on then to the addition, which was our COVID update.
Yep. So, Mr. Chair, I'm just going to share my screen. It's easier to receive this set of data from the province, July 14th, on the COVID update provincially and locally. And I used to provide this to the board frequently, and now it's good to be able to provide it once every 3 months or so, whenever the requirement is. So you can see that all indicators, whether it's cases, death, positivity, hospitalization, ICU, all of it is decreasing, which is reassuring. And the map of the number of cases, or cases per 100,000, the darker color blue is more cases, the lighter is less cases, and we are in the light with many other parts of the province. This graph, it shows the average weekly case across public health units. So some health units are increasing, others are decreasing. The blue is increasing, green is decreasing. The average in the province is decreasing. Grey Bruce is over here, is second lowest. And that would be the number of outbreaks, basically none. It's in the big cities in Ottawa and Toronto only. So that's, there is another set of data, but that's in general. Just want to give a snapshot of what's going on in the province and locally. Open to questions there, as always, Mr. Chair.
Thanks, Dr. Ayre. Obviously, like somebody still, this is their mandate, is to still keep doing tracking and forwarding information, which is good. I guess it'll continue on until there's no more cases. If that's the case,
so, Mr. Chair, there's always going to be transmission of COVID. I don't see it going away, but that's similar to any other infectious disease that we monitor. We have this sets of data on many diseases, but the interest in COVID because of the pandemic brought the item forward.
Any questions for Dr. Ayre? Sue Patterson.
Thank you. Dr. Ayre, is there any recommendation to have another shot in the fall, and any specific age group, everyone or seniors or?
The NACI recommendation, through you, Mr. Chair, the NACI recommendation is for seniors, for people who are having other comorbidities, heart, lung disease, or immunocompromised individuals to have the booster shots in general. Having general recommendation to the public, if having a booster shot would be similar to the flu, it's useful for all ages as well.
Okay. Yeah, Dr. Zay wants to add a point, I think, to that, and then Sue will go back to you again.
Well, I was just going to say where, like at your pharmacy, your healthcare provider.
Through you, Mr. Chair, we have received also from the Ministry of Health information about and the Public Health Ontario about the every year we receive this information about how the Southern Hemisphere is doing in terms of respiratory viruses. So it looks like there is high number or high this year. There is more cases or more severe. We had that before with unmatched vaccine in one of the years, but we are we are in the process of preparing, doing some preparation for the fall, including tabletop exercise, which is a simulation exercise, including all the partners and including the Ontario Health as well. They are doing similar exercise as well as public health units related to preparedness of respiratory virus in the fall, and including also the recommendation about COVID and influenza vaccine in the same time. Where to get that is pharmacies and primary care and public health. So we will have more of information about that after we will have this exercise in August.
That totally answered your question?
It did.
Okay, thank you. Helen Claire.
Sorry about that. I just want to make sure that I understood what the information that was provided, that I'm not misinterpreting it. Generally, across the province, the numbers look good. Specifically in our area, they look very good. However, there are some patches where COVID-19 is, as shown by dark blue. And I noted that those areas are all around this particular catchment area. We seem to be standing out as being okay in that. So did I read that right, Mr. Chair, to Dr. Ara through you? Thank you.
Yeah, through you, Mr. Chair, I'm just going to go back to the map to make sure that this is the slide you're referring to, Helen Claire?
It is, yes, and also the little table that came after that. After this, the next slide, I think, or the one following.
Oh, the table, this one?
Keep going. You actually had a list on the bottom of communities. Keep going.
I don't
There we
believe
go.
I went.
This is it. Sorry, back one.
Oh. I didn't present that. Did I present that?
Yeah, if you go back one.
Up one.
Oh, this one?
Yep.
There we go. So what I'm seeing on the
So
bottom there, on the left-hand side, are the outbreak or the positive tests. The public health units that are close to us are the darker shaded ones, or the ones that are higher, therefore. So although the province generally looks good and we specifically are doing good, it would seem to me we need to be diligent that the messaging that goes out isn't that, hey, everything's all cool, especially at this time when there's a lot of travel and we are approaching the flu season. So I wanted to make sure two things. One, that I've read that data correctly as quickly as it was flashing across the screen. And second, that my assessment of the risk to us as a community to not be nonchalant is also accurate. Thank you.
Sorry, Mr. Chair, this is the one I presented, not the positivity. Like this, there are two that look very similar. I didn't present this one. I presented the upper one here.
But my points still remain in terms of the public health units close by are the ones that are in the dark blue.
The health units are close by.
The blue one.
Back to your photo of.
Oh, this one.
I think in summary, you're saying, Helen Claire, don't get too close to our neighbors.
So this map is in general showing the circulation of the virus, and it's closer to the big cities. You would see London here, you'd see Toronto, Ottawa. There is some circulation here, probably could be related to cottagers, people from these cities going to cottage. The virus exists as similar to common cold. It's the same family. It will continue to circulate so long that the ability of the healthcare system to respond to it, it's not going to be overwhelmed. So we're not back in emergency level. That's the main message. The other message here is, yes, the circulation in our area is very low. And my apologies, I didn't put this percent positivity. I looked at the average weekly case, which is more relevant indicator than the other one. And you know, there are some of the health units, smaller health units like Porcupine or Renfrew, where there is some increase, but in general, even if it's increased, it's going up and down under 10 cases, in general, under 10 cases per 100,000. So even for the ones that are increasing, it's not very concerning from system point of view.
Okay, thank you. That answer your question and comments, Helen Claire?
Thank you very much for that that detail. So the takeaway is, even where there are cases going up, they continue to be mild, as you said, like the common cold. So there's not actually concern for sort of widespread panic. I'm still hearing from people this kind of outrage about the virus and about the concerns, and that it's not over, and we're all going to get long COVID, and there's this terrible thing waiting down the road for all of us. So that's sort of what I'm trying to get at through you, Mr. Chair, to Dr. Ara. To some people, it's difficult to break through this data, to understand the stats. What does it actually mean to us when you see these dark blue things? Oh, that's terrible. There are still these outbreaks. But if in fact the risk is low, if in fact, even if you do catch it, that the chance of it being an extreme situation or resulting in quote unquote long COVID, I think we need to make sure that that messaging gets out to whomever's listening in on this, but also in our messaging about COVID. That's really what I'm getting at. I hope that was clear. Thank you, Mr. Chair.
Thanks, Helen Claire.
Through you, Mr. Chair, I see definitely your point. When I was referencing the common cold, I was referencing the circulation. So it's going to circulate. It's one of the common cold family will continue to circulate. The severity of it, I haven't looked at recent assessments, but in general, it's not. It's you know, when you look at severe diseases, it's definitely getting less and less severe as we proceed in time. Influenza has more yield of death, I believe, at this point than COVID. Nevertheless, like you said, the perception of risk is different, and it's product of many other things other than the actual risk itself.
Okay, thank you. Any questions regarding COVID on his update? None, then I'll look for a motion then to receive all three reports, 7.1, 7.2, and 7.3. Moved by Mr. Echoes, seconded by Mr. Saunders. All right with that? Sure. Any further discussion then on those three items that were presented then through the MOHL? All in favor? That's carried. If I get support of the board, Denis would like to add a further comment regarding the clinics. If we could go back then through that to the media releases. Dr. Aaron?
Yeah, thank you, Mr. Chair. Denis just reviewed the letters that went out, and if, with your permission, I can share his screen.
Yeah.
Just to provide the full picture.
Yeah.
I'm hoping you can see my screen there. Yes. So I just wanted to add that Communications has been working closely with our VPD team to promote our routine immunization clinics and support students in getting up to date on all required vaccines for school-aged children. And we've taken a four-pronged approach to communicate this messaging. And so one of them is, as was mentioned, one of the letters that were sent to parents. So this one was sent in June, and we always include a line with a reference to our clinic calendar, which is online. These letters were sent out in phases, so it was a little bit difficult to include a include a version of the calendar just because it is evolving, and it may be out of date by the time this letter goes out. We've also included a frequently asked questions page on our website with information on the importance of getting up to date on vaccines, what is required, and the clinic calendar. And then we've also on social media launched a campaign for throughout the summer to promote our vaccine clinics. And then, as Dr. Zayed mentioned, we are looking at moving forward with a text direct to parents as well. So I just wanted to add that additional context.
Okay, thanks, Denise. And Dr. Zaid?
Yes, through you, Mr. Chair, as I mentioned, this is a package of a campaign that we crafted. So that's why we wanted to get back to you next meeting with all the details. But we have really had a thorough meeting about how to approach in multiple strategies.
Okay. Any questions from anyone on that?
No.
I think that's Mr. Charbonneau.
Yeah, thank you, Mr. Chair. I appreciate, just want to thank you for that information. You can, I think that anything we can do, because it is a tight turnaround in those letters, right? It's, you're looking for 2 or 3 weeks. And our clinics may or may not fall in there. And of course, it's a letter you receive in the mail. So a link to a calendar on the in the letter that you receive in hard copy doesn't help you much. So I think I appreciate all the challenges in terms of the timing and when the clinics are and whatnot. Anything we can do to have more clinics or more opportunity or to plan them far enough ahead that we can communicate them when they are and where they are in those letters that go out to parents, the better. Because you know, it's difficult. It is not just easy to get those vaccines quickly within the timelines that public health is requiring them. I understand that the law is the law and the letter is the letter because of the law. But I just tell you that it's creates some stresses for parents, and I know you guys are working on ways to make it easier. And so I just encourage you to keep doing that. Thank you.
Okay, thanks, Luke. So I guess in summary, we'll look forward to next month's report. Okay. Moving on then to the financial report. I understand Kim is away. Who's taking it, Dr. Eric? You are. Okay.
Yes,
Sure.
Mr. Chair. So just share my screen as well. So Kim is on holiday, but she prepared the report a couple days ago. And in general, the mandatory program COVID expenditures are currently covered by the mandatory fund. And have a surplus of around 50,000. Senior dental program had a deficit of around 72,000. The remaining surplus of around 21,000 is in the funding for other government agencies program. We continue to wait for the proposed budget for the ministry approval. We asked for 2.5. So since we have not received that, we continue to see the deficit in the budget, or sorry, we're below budget. And the capital project, I know the release standard from Canada Standards Association has a project team reviewing the airflow in the clinic in Walkerton, and that new standard requires new assessment. So we have put it to market, and we'll see. We're expecting that we might be under funded for the one-time funding for the clinic in Walkerton, and we are in communication with the ministry to see if how we can mitigate this, and we'll keep the board updated on that front. The rest of the report is as usual, data on the past 2 months for the budget.
Any questions then regarding the financial report? Look for a mover and seconder then to receive that, please. Moved by Luke, second by Warden Milne. Any further discussion then regarding the financial report? All the votes and all in favor, that's carried. That takes us down then to see in camera. Give Kelly a minute to be able to stop our recording, and then we'll proceed into the in camera. So then we should make our motion to go in camera before she cuts it off. Okay. So could I have a moved by Luke Charbonneau, seconded by Sue Carlton, that we go in camera to discuss items presented, as in 4 items that are listed on the agenda. All in favor then to go in camera? That's carried. Okay. So could I have a mover then, to ratify the terms of the owner agreement as summarized on this, form that was sent then by Kim on July 28th? Luke? Charbonneau moves and Kevin Eccles seconds that, so this document then, this memorandum will be the motion then. Or sorry, will be the contents that will be in it, the substance of it. Okay. And that the motion reads that the Board of Health ratify the terms of the owner agreement as summarized below. Any further discussions then on that? Seeing nothing, all in favor? That's carried. Last item then is, so for the next meeting, not sure where we're going there. I was under the impression we were trying to change it. Are we back to having the same date?
So we're looking at September 13th is the date that has the best work for everyone. Let me see. It would be Wednesday, September 13th, around 10 a.m. till 12 p.m.
Okay. Yep, okay.
Sounds like a lucky day to me.
This is
On
strategic.
Friday, the 13th.
This is our August board meeting.
September 13th.
Seeing nothing else before the board, call an adjournment for this meeting moved by Warden Milne that we adjourn. All in favor? That's carried. Thanks, everyone.
Thank you, everyone.
Thank
Bye
you.
for now.
13th.